I'm Whitney.
And I'm Amy, and this is Midlife.
But you are anything but mid. Take it. Believe it. Own it. Okay, I went a little overboard. Hi, Amy.
Hello.
Hello, how are you?
I am great. How are you?
I'm okay.
Just okay.
So my mid moment this week was that I have to get a crown.
I don't even really understand what a crown is.
It covers your I don't really know. I think
and you don't mean like wear on your head.
I always have on my queen crown.
That's right, straighten your crown.
But this is a crown for my mouth. And
what is it? And
well,
why?
all I know is that I had a filling in, and it was a metal filling, like it was old.
Yep.
Right, and it kind of broke loose, and so this is so gross. There was some decay in there that was eating away, and I didn't have enough tooth left to save that tooth, basically. So they have to scrape out all of the decay.
Oh my God.
And then put a cap on it, which they call a crown. So they've capped it.
So you just have this little sad little tooth underneath?
Just a teeny little bit of a tooth, and then they cap it with a crown. They cap it.
Is it hollow inside there? Or?
I don't really know.
Or is it something smushy?
Today I had to go. My mouth is still a little numb.
Oh, God, it's so
I can't
it's so
suck.
awful to
I can't suck out of a straw yet.
I'm so sensitive to mouth pain. I am super weird about the dentist. I have stopped them mid cleaning and been like, we're done here. Like I've literally been like, we're done.
My mom and my sister are like that, and I never really got it. And they have so much trauma.
Lucky. You're so lucky.
But listen, so they have so much trauma that they're just traumatized for weeks before their appointment, you know? And I'm always like, what's the big fucking deal? Well, today I had to go in. So it's a two-parter. You go in and they clean everything out, and they put a temporary crown on, and they make a mold of your mouth and your teeth and everything. And then you get a permanent one in like 2 weeks.
And so you got
So I got that today. And
you got the temporary.
I got the temporary. So couple things. One, redheads need more anesthesia.
That's right.
And so I told her that. I was like, you know that redheads need, and she goes, oh yeah, I know, it's a real thing. And I'm like, yeah, it's a real thing.
Wow.
3 shots, and I could still, she tried 3 different times to start. And first of all, it is such a mental thing when you've got your mouth wide open and you smell the smell of teeth grinding, and you hear the sounds, and you taste the taste.
My body gets so tense.
Yes.
I sweat.
So
I need to
tense.
be put under. Why can't they put us in?
So she said, I think you need the laughing gas. Well, it's $160.
Fucking A.
And I'm like, no, I don't. I've never had to have gas. Like, I can do this. But she had to stop several times, and I had to breathe through it. Like, it was such a mental game of like breathing through my nose and like trying to. It's very, wherever you put your focus and your attention, that is what area is going to grow. And of course,
I guess, but it's
your
so
mouth,
sensitive that I will like full body.
I had never understood
twitch.
The trauma that people felt towards the dentist until today. I felt like there were 10 hands in my mouth with 10 different tools and scraping and and all this stuff, and my mouth is wide open. My lips are so dry.
Right.
It was so traumatizing.
It's so awful. And we're living in this day and age. We're in 2026. Can you imagine what people went through 50 years ago?
They drank a whole bottle of bourbon, and then their tooth got pulled. That's all they could do.
I may have to drink.
Well, I honestly, I refused the Happy Gas. Plus, it was really weird when they came in for the 3rd time, and they were like, look, you really probably need to get the gas. And I'm already kind of traumatized at this point because I've felt pain and they've been in my mouth for a while. I got teary. I was like, I don't want the gas. I don't want to feel out of control.
Yeah.
This isn't like going to have margaritas with my friends. Like, I don't want to be
Have you had the gas
loopy.
before?
No.
Oh, it's awesome.
It was in my mind now about I was going to be acting weird or vulnerable or whatever. So I was
feel
just
like
like
you're floating. But it feels
your
really
hand
good,
starts to go up and they have to keep your hand
It doesn't really take away the trauma for me. Like I still know what's going on. I'm just high. And oh my God, that's why when you said, oh, I've got to go get a crown and I'll meet you to record. And I was like, are you sure you're going to be okay?
I had no idea. I've never had anything this extreme done to my mouth. I've just had a cavity here and there. So I didn't really understand. But because of this experience, today's episode is all about oral hygiene. Because, and I've heard it a million times, oral hygiene and longevity are linked together.
Yes.
Your mouth is a gateway to your internal organs.
Yes. Well, yes, I actually did a 2-part series with a biological dentist.
You did.
Fall. Yep.
Don't you now?
So,
now I understand. Like you know,
So,
dentists have to really enjoy traumatizing people.
I mean, seriously. Well, okay. So I went to lunch with a friend. And she was telling me about her thyroid issues. And she said, well, you know, this one tooth I've got is connected to your thyroid. And I was like, pardon me? And so each of your teeth is connected. So I start to look this up.
Well, I need to find out which tooth that got my crown on.
I can probably
But I don't know
you.
what the name of the teeth.
Well, there's a little chart.
This is Howard.
So there's a little
Sarah.
chart. Let me find it.
Okay.
I actually went and found it after she and I had lunch, and I sent it to her, and I was like, I must have emailed it or something. I don't see it. And maybe it was a link. And so anyway, I was like blown away.
Ask
right?
Gemini
Ask
now.
right now. So there's a chart that you can find that shows you the whole everything inside your mouth. And so okay, let me back up even further.
Okay.
So I did an episode 193.
But are these teeth connected to the organs? Like I'm trying to ask what organ each tooth is connected to?
Yes.
Okay.
And so let me just back way up. So I did a podcast with Risa Grew, who's a nutritionist.
Okay.
It was episode 193, and I did it I think October of 2024.
Okay.
And so Risa tells me a story about how she was having all these thyroid issues. So she did gut testing. In the gut test, they found a weird salivary bacteria or salivary indicator in her gut. And so she went and got a head scan or something like that, finds out that when she had her wisdom teeth removed like 20 years prior, they left a piece of metal in her mouth and a little bit of a root. So she gets that shit removed. It heals her fucking thyroid.
So
she becomes and she never had any other symptoms.
So she's a holistic dentist.
So she is the nutritionist. So then I'm like kind of obsessed with this, right? So I go to lunch with my friend, and my friend's like, my tooth is connected to my thyroid, and I'm like, holy shit,
tooth is connected to my thyroid.
Exactly. So yes. Right. And so then I'm like, whoa, I didn't know that all your teeth were connected to something, but I tell her the story about Risa. Then I get an email like right away pitching a biological dentist.
I love when the
to be on my
universe
show.
does that, man.
Right.
And
I'm
love
like,
that.
Big fat yes. So So then she and I do 2 episodes because she was like a total rock star.
Oh, I'm going to have to go listen to it.
That
episode 190.
From last, I did it like for Halloween because of sugar and all that. So that's episodes 245 and 244. Last October in 2025, her name is Dr. Tony Ingram. She's a SMART certified biological dentist, and she talks about the oral hygiene body connection.
Well, the tooth chart that you're talking about is the meridian tooth chart.
Meridian. Thank you.
So here's a simplified summary of the organs associated with certain groups. So the incisors, the front teeth, which are 7, 8, 9, 10, upper, 23, 24, 25, 26, lower, I don't know. Kidneys, bladder, your urogenital system.
Cool.
Canines, your eye teeth, liver, gallbladder. Mm-hmm. Premolars, lungs, large intestine, stomach, and spleen. Molars, stomach, pancreas, spleen, and liver. And wisdom teeth, heart, small intestine, central nervous system. Why the fuck are we getting our wisdom teeth out if they are connected to our heart and our small intestines and our central nervous system.
Well, because it can crowd all your other teeth.
I
And there's
know.
actually a lot of good reasons to have your wisdom teeth out.
Guess what? Guess who still has all of her wisdom teeth?
You do?
Yes.
Let me see your teeth. Wow.
They never came down.
They
They're
never
in
came.
the-
Wait, they're still in there.
They're in there. They never, that's why
Interesting.
I think, look.
So they just never came
Well, let me put it this way. I never had my wisdom teeth removed.
And you don't remember like when you were 18 years old, some new teeth coming in?
No.
Wow.
I know. All the wisdom is still right up here. All right. So this is so interesting because I have heard this before. And look, I brush my teeth and I floss sometimes. And I've got a water pick.
I floss religiously every single
after
day.
Today's
Start
horrifying,
what the hell?
Horrifying experience.
Yes.
I am going to take better care of my teeth. Now, I did ask the dentist, I go, is this because of hygiene or is it because of the grinding that I do? And she was like, it's a little bit of hygiene because you had a cavity, you had a filling that then got opened up and more decay got in there. So, but that was like when I was little, that when they were still putting metal fillings in.
Yeah.
And then, are they still putting metal fillings in? No,
they're not. And one of the things I learned with Tony, which I'll just interject these
yeah,
as I
please,
can,
I
Dr.
want
Tony.
you to.
Dr. Cavities are a family issue. It's not necessarily oral hygiene. Cavities can be passed around in a family. And so that's why.
You mean just genetics? Not you're kissing and you pass your cavity on to the next person.
You're kissing and eating together and that's what it is.
Because it's a bacteria?
I think so.
I can't even.
Yeah.
That's making my mind explode. Now I'm never going to want a French kiss again.
You're all right.
No, I cannot experience what I experienced today ever again.
It's so bad. And you know what? I'm just going to go off on a little tangent. My dentist, I got to find a new dentist anyway because my dentist has turned into Trumpville. He has literal statues of Trump. He wears Trump ties. It's like
he's gone off the deep end.
I came for teeth cleaning, not indoctrination.
Right.
And plus I'm not a Trumper. And so I am like.
Is he blaring Trump speeches over the intercom?
It's been a few months since I've been. So it's been like, I'm dreading going. I'm going to have to leave. I have to leave now.
Today, while her gigantic hands were in my mouth with these metal objects that are crashing up against my little lips into my teeth, and I can't move anything because everything is crowded. Yeah. And I'm like, she's going to give me a busted lip. And I was thinking, there has to be a part of her that is really into this. Like, she's not even thinking about my lip is being pushed by this metal.
They didn't put some lip balm on
They put a little Vaseline around it. But this was, all of their tools are hard and it's pushing into my lips.
There's
I don't know.
got to be a dentist that knocks you out for this.
And I also thought in 2025, when there's all these other surgical ways like not LASIK, but laser surgery and stuff, things that are non-invasive for your internal organs, why can't we figure that out for the fucking mouth?
Why can't we?
Anyway, it has driven me to do way better. I am not going to put myself in that position again, and I'm going to make sure that my kids are not in that position. It is horrifying. So let's get back to this oral hygiene and longevity. I'm fired up.
Wow.
So did you know, you probably already knew this, the mouth is the second largest biome in the body after the gut.
Probably.
That makes sense.
A lot of this is probably stuff she told me, but I'm so forgetful.
So I'm gonna lay down just kind of why the oral hygiene and longevity in your teeth are all connected, and then I'm gonna go into the protocol, the procedures, the things that you need to do in order to keep you out of the dentist chair.
Great. Well, I can supplement this as we go.
So your gums are like a seal or a fence, right? When the seal is healthy, it keeps the bacteria where they belong, not inside your system. It's not in your body, right? The gums are the fence that keeps everything out.
Wait, the gums or the teeth?
No, your gums
are the fence.
Yes, your teeth are there to chomp down and eat.
Right.
But the gums keep all of that food out of your system, right? And all the bacteria that is created from food that's sitting in between your teeth.
Okay.
Anyway, if there's a breach, if you have gum disease, then the fence is broken and it creates tiny links that allow bad bacteria to escape into your mouth and enter your bloodstream. Side note, one of the widows on my Every Widow Thing podcast, her husband died because his son had strep. Then he got strep. He didn't know he had strep. He went to a dentist appointment and got his teeth cleaned, and that strep went into his system. And he was 37 when he died. And he was so healthy that nobody, and he went to the doctor.
What?
The day before he died, he went to the doctor with excruciating back pain and something else, and they just said it was a pulled muscle. They sent him home.
I have chills.
He had the worst night of his life, and then the next day, while they were getting ready for work, he basically died in the home. And then they got him to the hospital, and I mean, he never woke up. He was in a coma. But it was because of strep that got into your mouth and into your system because there was a cut or something because of the dentist. It opened up the fence and it broke. And
isn't
strep
strep already in your system? But oh my God,
I don't know all
strep
the ins and outs of it.
Special thing.
Yeah,
too.
It's like strep
types.
A. I can't remember the name of it, but
wow.
But he was 37 in great shape, and because he was sick and went to the dentist.
Wow.
That got into his system in a different way, into
a lot
his bloodstream.
Of people, I remember my dad having problems with it. He was a lifetime smoker, and he had to take antibiotics and stuff sometimes.
Yeah.
If you get your teeth
get a lot
cleaned,
of antibiotics.
You don't have to do that. That fucks up your gut too.
Right. So once this enters your bloodstream, the bacteria can travel everywhere, your heart, your brain, all your organs.
Okay.
And your body sees these obviously as intruders, tries to fight them. It creates the inflammation. And then, it's like a fire that never goes out, and it wears your body down over time. So that was an extreme case of strep, and he died. But you can have this bacteria that's just slowly eroding your organs without you realizing it. But the first indication is your teeth. Yep. Your teeth can tell you what other issues are going to happen in your body.
For sure.
So clean teeth, healthy gums keep the fence strong, preventing that inflammation and shortening your lifespan. Here are a couple of links. So bleeding gums is chronic inflammation. It also can be a sign of diabetes.
Yeah, bleeding gums are really bad. You got to do something.
Yes, I know when I am when I went and got my teeth cleaned, which is how I knew that I had to get this crown. She was like, you have a little bit of bleeding in your gums. You need to be flossing more. Your gums are inflamed. So you got to get that down. And I was like, oh, I thought I might. Yeah.
One time, this is like in the 90s. This is like 1996. I went to see a friend in Dallas, and she took me to her work with her, and I can't remember why. Anyway, she had a colleague that she was working with, this woman who came in, and her whole face was all swollen like this. And I was like, oh no, what happened? And she said, oh, I was eating popcorn, and a popcorn kernel got up into my gums and caused some sort of problem. And her whole face was, can I tell you that there is not a time I eat popcorn in those 30 years since I've heard that story. And
because it was traumatizing.
That I haven't thought and been so scared of that. And if I get a popcorn kernel caught, even when I'm flossing, I'm like, this is it. I'm going to turn into that.
It's Claire all over again.
You know how you just get traumatized by something you've heard, and then you never forget it. Yeah.
Yes. Well, hopefully people are going to not be hopefully people will be traumatized by what we're telling them enough to go and start a better oral hygiene protocol.
You already did this preparation though before you went to the dentist?
Yes. So I went and had my teeth cleaned like a week ago or whatever.
And that was when
when they said you needed a crown last February. Shit. And I'm like, oh, I did? I just blocked that out. And then I'm like, well, shit, I didn't want to do it, but I was like, I'm just going to do it. And I had another friend who had a lot of dental work done who was now religious with his flossing. And so it just made me start thinking, oh, I know that there's a connection, but I wasn't clear on it. So I decided I would do some research. And then after today's traumatic event, I was like, oh, hell no. I'm going to shout this from the rooftops so that nobody has to go through this. I am not a person that typically is traumatized by the dentist, but I've never had any big major issue.
I haven't had a big major issue, really.
You just don't like
I'm traumatized just by
mouth.
even a cleaning, and I floss religiously. I saw this commercial when I was like 12 years old. There was a commercial running. I mean, like, in the afternoon with Scooby-Doo or whatever. And it was this older woman, and she was like, I started flossing when I was 17, and she still had all her teeth and everything.
Yeah.
And I was like, okay, I have to start flossing at 17. And literally, I turned 17, and I was like, no, I have to start flossing. And I flossed.
You have one of those
every
minds.
day since I was 17. I will floss blackout drunk. When I used to drink. But yeah, I mean, like
on red cherry tart cherry juice.
Yeah, I'm a flosser, but anyway, I just I'm still traumatized by it. Like I don't know.
Yeah,
if you know of a dentist that knocks you out for all this stuff,
I think you're gonna have to take like a Xanax or ketamine or something.
Valium.
Not ketamine.
Not ketamine.
Nasal
maybe
spray.
Actually,
maybe I don't know. All right. Another oral issue is a persistent dry mouth. That's autoimmune system issues.
Ooh,
like Sjogren's and Lyme disease and stuff. Sjogren's.
What's
You heard of that? It's an autoimmune disease, and dry mouth is one of the main, there's a ton of symptoms, but dry mouth is really
my mom had
bad.
I'm just
I know. And then my mom
had
one time at band camp,
ulcerative colitis, and she had to be really, really careful getting her teeth cleaned and stuff because of that connection with your gut and stuff.
Eroded enamel, acid reflux, that could be acid reflux or GERD, or an eating disorder, which is also acid reflux.
Words I've never heard.
Never heard of GERD? It's basically acid reflux.
Ew.
Jaw pain, which you and I both, what do? We grind our teeth.
I need a new night guard.
I lost mine for like a week, and when I went to the cleaning, they were like, well, you're going to need to get another one. Like your teeth, you're ruining, your gums are receding to a level. And by the way, once your gums recede, there's no bringing them back. Like they don't grow back. Although I'm going to use Joe Dispenza. Yes, that guy. And I'm gonna use what he believes as, the mental focus on it. And I'm gonna start telling my gums to regrow. I'm sorry, but I can't believe that only some of our organs can regenerate and not all of our organs.
Yeah. Gigi got braces, and her gum grew down over part of the braces.
Ew.
And then when she got her braces off, it was still puffy. So your gums can grow.
I don't know. I don't think so. My dentist said once they've receded, there's no coming back from that.
I'm not gonna.
But maybe hers were inflamed.
They were.
That's what it is. It's not that they're growing. It's that they were.
Shit. God bless her, poor thing.
Anyway,
she was not happy about it. And finally, I was like, just take her braces off. They were like, she needs them longer. And I was like, just take them off. It was getting bad and it wasn't getting better. And so I was like, just take them off.
Well,
she didn't even like her teeth when she was done, but now her teeth are fine.
It was probably more that she wasn't flossing or brushing properly. So it was getting all inflamed.
Sorry, Cheech.
Anyway, jaw pain also can be a warning sign for cardiovascular issues.
Wow.
Ew. All right. How oral health impacts specific organs. The heart.
This is our meridians,
yes.
too.
The heart. Gum disease is linked to 20 to 30% higher risk of heart disease. Bacteria from the mouth have been found inside arterial plaques, contributing to blockages and strokes.
Whoa.
Isn't that crazy?
Yeah.
Brain. Recent studies have found oral bacteria in the brains of Alzheimer's patients.
Wow.
Chronic oral inflammation is now considered a key risk factor for cognitive decline.
Holy shit.
So your dentist knows a lot about you just by looking in your mouth.
Oh, yeah. They can tell if you smoke weed, too. Your teeth turn green. Mm-hmm.
On the inside? Like on the back end?
In those little crevices and stuff.
Interesting.
They can spot weed usage.
Wow.
Maybe it's only
lungs.
Actual weed.
Bacteria from dental plaque can be inhaled into the lungs significantly.
Wait, say that again.
So bacteria from dental plaque, which is what builds up when you're not brushing properly.
Can be inhaled?
Think about it. It's in your mouth. Oh. It can be inhaled into the lungs and increase the risk of pneumonia and COPD, especially in older adults.
Wow.
Your metabolism. There's a two-way street with diabetes. Gum disease makes blood sugar harder to control, while high blood sugar makes gum infections more severe, which makes sense.
Hold on, you're talking fast.
Oh, sorry.
Okay, so
Metabolism.
So
there's a two-way street with diabetes.
Okay.
Gum disease makes blood sugar harder to control.
Yes.
While high blood sugar makes gum infections more severe.
Of course. Anytime,
right, that makes sense.
Anytime you have too much, like high blood sugar.
Yeah.
All that shit's going haywire.
Well, and that's why knowing your glucose levels and making sure, like you said, you're eating things that aren't spiking that.
Yeah.
That's, as far as glucose goes, you can just walk for 10 minutes after every meal.
Yeah.
And it will regulate your glucose.
Actually,
so you don't even need one of those
When
monitors.
I had Natalie from Upgrade Labs on my show, she was saying, okay, if I wanted to eat a pancake with syrup, she was like, I'd probably stand up, do 10 squats. And she had this whole little protocol. And I was like, what am I hearing right now? But yeah, like you don't even have to go for a 10-minute walk. You can literally do 10 squats. And that's going to make a difference.
Squats.
To
I would rather go on a nice stroll.
10 little squats?
Yeah,
it's
okay.
so easy.
I don't really like syrup anyway. But anyway, all right.
Good, because that would be bad for
What
your
is
teeth.
your mouth saying about your health, Amy? Your mouth shows symptoms of systemic issues before they appear elsewhere.
Wow.
So listen to this. Research published in early 2026 shows that
Okay, this
it's
is
recent. Shows that older adults with 20 or more natural teeth have a significantly lower mortality risk. Losing teeth often predicts oral frailty, which leads to poor nutrition and muscle loss. Well, think about it. If you don't have a lot of teeth, you can't eat much.
Right.
You're just eating mush.
That's right. Oof.
Not a lot of meat.
I mean, I don't ever want to be that. I wanted like all my teeth. My grandmother's had one of my grandmothers for sure had dentures, and I just always thought that was
my dad had
concerning.
dentures.
Really?
He was an alcoholic, so
Yeah.
I think all the sugar from the alcohol just ruined his teeth.
Wow.
I mean, I'm no
Wow.
expert on it, but I
Now
think
you
that
are.
a lot of alcoholics have bad teeth.
Whoa.
Anyway, bleeding gums, which we talked about. This isn't just about brushing too hard, but you do need to be careful with how hard you brush because it will reseed your gums.
Yes.
Which is what happens to me. I notice that I'm brushing really
Vigorous.
hard. Yeah. My hand goes just too fast. Anyway, it's a sign of a compromised immune barrier and systematic inflammation.
Damn.
Dry mouth, which has another word that starts with an X.
Let me see.
Xerostomia.
Xerostomia.
Often an early indicator of autoimmune issues like Sjogren's or a side effect of medications. Do you want to know how to spell Sjogren's?
Sjogren's.
Yeah.
Okay.
My friend has it.
So dry mouth.
It's really hard. Yeah. It's more than dry mouth. It's dry everything. And then it's an autoimmune thing. So tiredness. It's not out of all the syndromes. No syndrome is fun. Anyway, breath odor, halitosis. While often it's just hygiene related, it also can indicate diabetes if it's a fruity breath, diabetes, if it's a fishy smell, kidney issues. Mm-hmm. And I noticed that with my dog who sadly has bone cancer. Oh. His breath smells different now.
Wow.
I know.
Yeah, my dog had to have a bunch of teeth pulled recently. Well, I didn't have enough money like liquid to pay for it for a while because I knew it had gotten kind of extreme.
Really bad.
Her breath was terrible, and I could tell like if we were playing or something that like it would kind of hurt, and so or she would stop playing, and I was like, uh-oh. And so finally I was like, I got to do this. So did you know this?
Mm-mm.
So I did it like mid last year or whatever. It was expensive, whatever.
And traumatizing for everyone, I'm sure.
She had to have 20 teeth pulled. I know. I
How
felt
many
like a bad
How many
mother.
teeth do dogs normally have?
44. So so she's got more than half now. But they were like, she's gonna feel so much better. Yo, she is a new dog.
Oh,
have you looked at her recently? She looks
Well, I'll tell
great.
you this.
She's lost weight.
She's not mean.
Feeling good.
She's not as mean.
She's not as mean.
She's not mean
She's
to me.
nicer.
Yeah.
She's
Which
gotten
makes
nicer.
sense when you don't feel good.
Yeah. So they said she was probably in pain and didn't even realize it. And so now
Because it's all she's
like,
known.
Oh, I felt like a really bad parent. But it was expensive, right? It was really expensive, and I just didn't have the money to devote to it right
and
then.
you get to a point like with your animals, you're like I thought this because my bulldogs before this dog, we'd go to the vet and they'd say he needs to get his teeth brushed, and I'm like, in the wild, these dogs weren't brushing their teeth. Like, why? Why do these dogs all of a sudden need to be brushing their teeth?
Maybe they didn't have as long a life, and they're bred, specially, and all that kind of stuff.
And their diet is different. Do you know how many teeth adults have? Adult humans?
32.
Good. Do you know how many teeth children have?
20.
Yeah. How the fuck did you know that?
I literally have been in a teeth mode for like last year. I'm telling you.
I'm really into teeth right now, you guys. All right, let's get down to the protocols of how to keep these dentists out of our mouths.
God dang it. I got it.
Because
I don't even want to get my teeth cleaned.
We can do this, you guys. We can do this. It just takes a little bit of dedication and trusting the system. Like, that was part of it for me. I was like, whatever. I'm not going to fucking floss all the time.
Why were you blowing off flossing? That's weird. Whitney, that's a big deal. Weird. That one's proven. Everybody flosses.
Amy, I bet you, and we'll do a poll on Instagram. Okay. I would bet you that less than half of people floss regularly. I would bet you.
Everybody is crazy.
People don't know, but that's what we're doing. We're shouting it from the rooftops. The first thing that they suggest that you do is tongue scraping. Now, I knew this was a thing for a while, and even my son had a tongue scraper. But the truth is, if you get a stainless steel or a copper scraper, it removes the biofilm that accumulates overnight, so it prevents you from swallowing high concentrations of bacteria.
Yes. So the biological dentist I interviewed swears by it.
Yeah.
And I have tried, and I think it's gross, and I stopped.
That's the thing, is that I have to buy into this in order to create a routine. And I need to remember the horrific time I had today.
And make
what
sure that I
did.
What you just said is more convincing than anything I've heard about tongue scraping.
Yeah. It makes sense. It makes sense. I thought it was just kind of like a stupid trend that was going on. But no, you're okay. So yes, it is important. That's the first thing that you need to do is scrape your tongue. They say it's suggested stainless steel or copper scraper.
Yes.
But
that's what I've
had. You choose, but definitely need to scrape your tongue. First thing, that's the first thing you do.
First thing in the morning?
First thing in the morning.
Okay.
Then you delay brushing until after you've had your coffee. If you drink coffee or lemon water, wait at least 30 minutes before brushing, because that acid softens your enamel, and brushing too soon will cause premature wear. So
I can't brush when I wake up.
Well, that's what I normally do. I normally wake up.
First thing I do.
And brush. And that's great. But if you're waiting until after your coffee, don't drink your coffee and then go brush your teeth.
Oh, okay. No,
you can.
But I brush the moment I wake up.
You either brush your teeth as soon as you wake up after your tongue scraping,
or
you wait until after your coffee.
Okay.
30 minutes after.
Fine.
Okay. Then there's something called, I looked up how to say this, hydroxyapatite.
It is something that dentist
she said to do it. Yeah. Unlike traditional options, the hydroxyapatite is a biocompatible mineral that makes up 97% of your enamel. So it helps remineralize your teeth.
Yes.
Now, here is something that my dentist told me.
And you can get a toothpaste fortified with hydroxyapatite, correct?
Yes. There are toothpastes that are specifically hydroxyapatite. Yes. Okay, then this is something that I never knew until recently. You are not supposed to spit out the excess you can spit out the excess toothpaste, but you're not supposed to rinse afterwards with water. Like, what I do is I'll brush my teeth and then I'll rinse it and swish out and spit out the water. You're not supposed to rinse out the toothpaste. You brush your teeth and spit out the excess toothpaste, but you do not then rinse your mouth out with water. You have to let the minerals of the paste sit on your teeth and strengthen the barrier.
What?
I know. How come we didn't know this?
No one's ever told. What kind of toothpaste do you use?
Well, I just use fucking Crest and Colgate. Nothing great.
She recommends a lot of different ones.
But then also I saw this toothpaste called Hello that I used for a little while, but I don't know if it's a hydroxyapatite.
Mm-hmm.
I don't know.
I still use
Colgate or Crest.
I use Arm & Hammer Peroxicare. That's my favorite.
Arm & Hammer Peroxicare, which is like hydrogen peroxide in it.
Maybe. I don't know.
Baking soda, yeah. All right. Then throughout the day, you rinse with water after meals.
Oh.
You don't have to necessarily brush.
I like that.
And then I had heard about this gum like 6 months ago, and I thought I had a cavity and I didn't want to go to the dentist. So I bought this gum.
Turns out you needed a crown.
Yeah, it's this xylitol.
Xylitol gum.
Yes, and you can get it in a mint or a gum, and I was using it as a gum because I read, and then this research that I did here also says it promotes healthy oral environment. It starves off the bacteria responsible for decay. So if you pop a mint or this xylitol mint or xylitol gum in your mouth after you eat, it's supposed to keep that bacteria.
She recommended that too.
Yeah.
I keep pointing at my phone.
Yes. She's just sitting down here at our feet. Dr. Tony.
Dr. Tony Ingram. Yes.
All right. So far, let's do a recap. Tongue scraping. Brush your teeth first thing in the morning or 30 minutes after your coffee or whatever acid lemon water drink that you're drinking. Then use a hydroxyapatite
fortified toothpaste.
Yeah, use that. And then do not rinse your mouth out with water afterwards.
That was wild.
Then after meals, rinse it out with water. Use the xylitol mint or gum. And then the most critical step is at night, the mechanical cleaning. Floss or water floss.
Water pick, yeah.
So this is the most important step for longevity. You're removing the bacteria that's creating those leaks that break down your gum barriers. So focus on just getting below the gum line where the inflammation starts, flossing or a water pick. I have a water pick and I really like it, but I never clean it.
I don't know much about a water pick.
Well, there's water in it, and so water's running through it. So just like a humidifier or something, I'm thinking I'm supposed to rinse it or do something with it, and I haven't.
Seems like it could get its own bacteria.
And then even the little picks I haven't ever cleaned. I probably need to.
Maybe you just should floss.
Maybe. Flossing is harder for me. The water pick is easy.
It's really not that bad.
The water pick is super easy. Then
I think a water pick sounds cumbersome and like a pain in the ass.
No, it's great because it's getting in there, and then you're watching the little bits of food fall into the sink. It's very rewarding.
I don't know.
Flossing, there is a certain way you're supposed to floss, and I'll talk to you about that in a second.
Should I tell you how I floss?
Yes.
To see if we'll test me?
Yes, we're going to test you out. All right. Then at night, you brush for a full 2 minutes. Now, my dentist tells me, get an electric toothbrush. Do not use a regular manual toothbrush. It is not getting in the way that it needs to get in there. And for me, I'm brushing too hard. So if I have the electric toothbrush, I just you're supposed to put it on each tooth for like 5 seconds or something.
Yeah.
And go around each tooth.
Yeah.
So I got to get that next.
I have tried. We bought the Quip ones, I think they were called, and I think that's what it was. And it hurt. I had to return it. It hurt my gums.
The toothbrush.
The electric toothbrush.
Everybody talks about the Sonic electric toothbrush.
And then just like a regular one from the store, they say is better than what you use. But I use a Radius toothbrush, which are like a bigger head. I've used it for so long. But
it's not electric.
It's not. I love it. I love it.
What are your gums?
I've tried with the electrics, but do
you have receding gum lines?
I don't think so.
Do you go to the dentist every 6 months?
Pretty much, but except now that it's Trumpville, I am not sure.
You got to get somebody else. I have a lot of friends in your area. I'll ask them who their dentist is.
Well, I got to research and find maybe a biological
dentist. That's what I was about to say. You should do that.
I'll put it in the show notes. She gave me a website where you can find biological dentists in your area. So maybe I'll go to one of those, but I need somebody that's going to fucking knock me out or give me other ways to make it heal. I don't know if the biological dentist will do that. No, I don't either, but they would at least maybe be like, this is connected to something you're eating, so quit eating that and get a reprieve. Okay. So.
All right. So brush your teeth for 2 full minutes. Use the electric toothbrush with the pressure sensor. So your toothbrush
maybe
probably didn't have
maybe that's what I need.
different settings.
Maybe.
Aggressive brushing can cause gum recession, which is what I'm dealing with, and exposing the root and creating an entry point for systematic infection.
Wow.
Yeah, and I'm already recessed, but I'm going to start talking to my gums and tell them to grow.
I like that. Let's
I feel like it could work.
I feel like it could.
My vision is getting better.
What, you're talking to your eyes?
I'm telling my eyes to do better.
How often? And then, will you tell them that all the time?
I was doing it like for 6 weeks, and then I've kind of not been doing it.
Like every day, or?
Yeah, like when I'm putting my contacts in, I'm like, come on, guys. We don't need these.
Come on, guys.
We don't need these. Do better. Connect yourselves and do what you need to do in there.
Okay.
But so the last time I went to the eye doctor, my prescription was better. Isn't that crazy? I need to do it better. I need to do it more.
Oh, okay. That's really cool.
All right. So then the other thing that they say is, and you do this, you tape your mouth closed. You really need to ensure that you're nasal breathing, because breathing through your nose is the best way to deal with keeping your mouth, the bacteria out of your mouth. The mouth breathing dries out the oral cavity, and it's killing the good bacteria, and it's causing the pH to drop, and it's accelerating tooth decay.
I mean, you've heard when somebody says mouth breathers, that's like
my kid is a mouth breather.
Sorry.
I need to get him to tape his mouth.
Yeah, he needs to. It's actually good for your jawline. It's good for all your health. There's a book. Have you read Breath by James Nestor?
No.
Like, it's.
Do you have it? I'll take it.
It's so good. I listened to it.
Oh, you know what? I have it. I have so many credits on Audible.
Listen to it. It's Breath by James Nestor. It's so good that I know the name of the book and who wrote it. Like, it's
that's great.
so fucking good, because he does all these experiments too with somebody else, like only breathing through your mouth or only breathing through your nose. Even when you exercise, you should try to breathe through your nose, which is really hard. And it is phenomenal and will change everything about oral health, it's incredible. Again, it's all connected, and that's kind of the point with biological dentistry. Like, quit acting like this is its own little isolated thing.
Well, that's what we're learning just in the medical world right now. I feel like everybody is so specific for their own little their expertise on one little thing, that they don't step back and connect it all with the big picture. And our internists used to do that, but now I feel like they don't connect it all. Anyway, all right. I did ask my good friend ChatGPT, why do I have to brush my teeth in the morning if I brush them at night? Like, I just brushed them and I didn't do anything all night.
But it smells bad.
But it's because the environment in your mouth is a living environment, and it's not going to sleep when you do.
Oh.
And it said it's about cleaning up what happened in your mouth while you were asleep. There's a bacteria party in your mouth. Gross. There's a party in your mouth. You're never going to want to French kiss anyone again. The bacteria in your mouth is active, and it reproduces quickly in the warm, dark environment of your mouth. So by the time you wake up, there's a fresh layer of plaque on your teeth. There's tartar and an overnight buildup. So brushing in the morning wipes all that away.
What is tartar?
I don't know. It's something else to do with plaque and stuff.
Okay.
I'm not sure. Let's look it up.
I use a tartar control toothpaste. That's one of the things I like. I'm like, I don't want tartar.
Yeah, I don't think we want tartar. It's known as dental calculus, essentially dental plaque. It's plaque that's been left on the teeth long enough to harden into a rock-like substance.
Oh, yeah, okay.
So it's hardened plaque. Yeah.
Mm-hmm. I get that behind my front teeth, right there. I hate it.
It's because you're not brushing back there.
I brush like crazy back there because I know what happens.
Not with an electric toothbrush.
Oh, Lord.
Saliva goes to sleep when you go to sleep, so your mouth isn't salivating at night while you're sleeping. Oh. It's just that's
so the party's going on, but
it's a dry party. Not a kind of party I would want to go to. But it's a dry party in your mouth. Yeah. And so let's see, your body's natural defense.
I drool in my sleep.
Saliva contains oxygen and enzymes that neutralize acids and wash away bacteria. But at night, the production drops significantly.
But I drool. Like, I'll if my mouth falls open, if I'm not taping. Oh, even if I'm taping, my tape will get completely wet.
That's right.
I'm sorry, I just spit on you. My tape will get completely wet. And I'm like, it's soaking wet. What is wrong with
that? That is, well, I mean,
I've always drooled.
There are exceptions to every rule, and not everyone is the same. But you're having a wet party in your mouth. Some are having dry parties. You're having it. That's the only wet party you're allowed to go to. So, so protecting your enamel for breakfast, brushing first thing in the morning provides that defense. I'm on the fence about fluoride. Like, I don't get it at the dentist anymore. The fluoride stuff. Most toothpastes have it. What did your biological dentist say?
She too is not doing fluoride, but I have researched fluoride. I highly recommend a podcast called This Podcast Will Kill You.
Okay.
And they have a 2-parter on fluoride. Highly recommend. These women, one's like an epidemiologist and one's some other medical something or other.
Okay.
And fluoride is a naturally occurring substance in our water. So in many situations where the water supply does not have any fluoride, like say there's a city that doesn't have it, it will be fortified. It is not enough to hurt us. It is, according to that podcast and what I've learned, it is safe to do at the dentist.
But aren't we getting it in our water? Yeah. I mean, like if
a little. Yes, a little. And so what you're getting at the dentist is not going to hurt you either.
Right.
She says no. And anyway, I would say listen to the podcast and make up your mind.
Decision, yeah.
I personally think it's a good thing, the fluoride, and so
it is a layer of protection.
I've heard all the arguments. They cover all those in that podcast too, and it is super super interesting that it is almost lumped in as a talking point and gets very political.
Right.
So
we're making it to do about nothing.
Well, it's not like. About nothing necessarily, but yeah, actually, when they say it affects brain and stuff, like really the study that they did, it makes you drop IQ points. I think that's one of the big talking points about it. It might have dropped IQ points, like 2 IQ points, and like the study was very small, and like it was not anything significant to where
you're not afraid of fluoride.
I'm not afraid my kids are getting stupider. No. And like it should be in our water system.
Our kids are getting stupider because of iPhones and
yes, right. And too much of it is not actually going to make you stupider. What it's going to do is actually make your teeth worse. And so you don't want too much, but it's really closely monitored, and it's like we need it, and it's a good thing. It's
another protective layer
occurring.
Right.
Yeah.
Right.
So anyway, that's my take on fluoride is different than a lot of people's, and so I would say listen to those podcasts, and like I download their podcast like with whatever subjects I'm interested in, and then listen on flights and stuff. It's really interesting. You kind of doze off and listen. They have another really good one on, most of them are about diseases and stuff on that podcast, but so you can choose like interesting diseases like strep.
Right.
And, but they have another one on like raw milk. So occasionally they'll do a subject like fluoride or raw milk, and they're fucking fascinating.
Okay.
So
good to know.
They do the history of it all, and it's highly recommended. So there.
All right. So there.
All
right. Well, make your own decision about the fluoride. But at this point, I never want to go back to the dentist again. So I'm going to do it all. I'm going to get the tongue scraper. I'm going to get the electric toothbrush. I'm going to get the hydroxyapatite. Yes.
Yep.
Toothpaste.
Memorize it. How dedicated are you? Come on, say it once.
I know the appetite part.
Hydroxyapatite. There. If you're dedicated, then you better learn how to fucking say it. Xylitol.
Exactly.
Xylitol.
I'm getting it all, you guys, and I'm never going back to the dentist except for next week to get my actual crown. But it was so horrifying. I'm just trying to keep you guys from living the horror that I had to live. So please, if you do one thing today, floss.
I'm like, well, which one is it?
Oh, shit. We forgot to tell us how you floss. Because there is a certain way that you're supposed to floss.
Pull up the way. Okay, so I get enough floss to where I don't repeat a section.
Okay, yes, that's right. You're not supposed to repeat. And I didn't, of course, that makes sense. But I didn't really think about that. And I was just using the same little spot.
Really?
On the floss. And also I had these little flossers. And you're not supposed to use those either.
That's what Justin uses, and I'm like,
you're not supposed to use them because you can be too hard with it, and it will
Yeah,
end
they're
up
really
cutting
hard.
your gum.
I hate
Yeah.
those. I
All
hate
right.
those. So yeah, so I use a long enough piece to where I'm like, and I'll leave enough between my fingers to where I'm like not using the same little section. Like
Yeah.
I'll use this part, and then I don't have to keep doing it, like keep rewinding it between my fingers. Like I'll leave enough to where I can go cook cook, and then I'll go cook cook, and then I'll do a cook cook, and then do it. And you have to do the very back teeth. You can't neglect the very back one.
Yes, that's correct. That's correct. And the way that I can't find it in my notes anymore, but the way that I remember them saying it is you take the piece of floss and you slide it down the side of your tooth, and then you kind of come back up the same side. Like, what's this?
I just
How
don't
to
want to
explain this?
I don't want to go too close to my gums. I stay next to my teeth, and I go down the tooth and back up, and then the other tooth and back up. That's what I do.
I agree with you that you don't want to go too down your gums, because the point is, that's those pockets. Like, when you go to the dentist and they'll tell you how deep your pocket is.
They do? I've never heard that.
There's a word for it that's escaping me right now. But yeah, my mom, a lot, as you get older, it can happen, but it's because there's pockets down in there now, because you've created a pocket, and then food gets down in there. Yeah. And it's just not good. So there is,
Yeah. Well, anyway, I stick with I put it next to the tooth on one side and then the other side. And then
yes, you guide the floss between your teeth using a gentle rubbing, sawing motion. Do not snap it into your gums, because that's how you can cut into it.
Don't do
and
that.
then it's a C shape. That's what it was.
Yeah.
So yeah, the floss
go
reaches
along
the
the
gum
side of the
line
teeth,
and curve it into the C shape against one tooth. Gently slide it into space. Yeah. But yeah, I've been told not to use those little flossers because they're very hard on your gums. And then you're using the same piece of floss.
That's what Justin does. He walks around doing it, or he'll do it while we're sitting on the couch. And I'm like, I will literally just stop and look at him. And I'm like,
you're disgusting.
Because the sound of it, and he's like, sorry, I'm almost done. I'm like, ugh, I hate it so much.
I used to keep them in my car.
He could be flinging little bits of stuff.
Well, that's true. I used to keep them in my car when the kids were little, because they wouldn't floss. And I would just have them in the car, and it'd be like, everybody floss. But I never thought about the fact that it's the same piece of floss going to each tooth. So you're basically just carrying the bacteria
from tooth to
tooth.
But you were flossing anyway. Why were you telling your kids to floss?
Because I knew it was somewhat important. I was trying to be a good mom. What do you think about waxed floss?
Personally, I prefer waxed floss.
Do you have tight teeth? Yeah, you do. Your teeth are very tight.
Maybe it just feels better to me. Sometimes unwaxed is a little harsh on my gums. And so I like waxed, and I like mint flavored. But it just depends on the person. I don't know. I think there is a philosophy that one is better than the other.
If your teeth are tightly close together and you don't have a lot of gaps, which I have some gaps, but then there are some teeth that are close together. The waxed floss, you're not going to damage your gum. It's not bad. No, it's best if your teeth are close together.
I do. I used a waxed mint, but you know what? In a pinch, I'll use whatever.
Yeah. I'm still using the water. I was proud that I got the water pick, but now I think I have to do both. And I probably need to throw my water pick away and start over.
Just get a new one. And
I think I'm going to have to.
There's probably some advances too that have some sort of sonic cleaning thing with it or whatever.
Yeah,
so
maybe so.
Yeah, probably.
All right. Floss, electric toothbrush, tongue scraper. You'll thank me in 20 years when you have all your teeth and have never had to experience the horror of a crown.
Oh,
or a root canal.
Sorry.
That's
yeah, she goes into root canals on there, and boy, that's fascinating too. But she also said you can heal cavities. You can heal cavities. You can. I know.
Okay, with the gum.
With the gum.
That's what I thought, and for like 6 months,
or with the hydroxyapatite. I think there was more than hydroxyapatite.
Okay, because I had read about that gum and tried to chew it for quite a while, and then still had a cavity.
No, I think it's the other stuff. So maybe listen to those too if you're really interested. Yeah.
We hope we have helped you today in some way, and thank you for listening.
I mean, do what you want. You know what? It takes all kinds. Maybe you love going to the dentist. Maybe
Look,
you do.
And I mean, maybe you don't want all your teeth.
I had an old boyfriend who said that his mom had tooth
problems.
You're going to
say that didn't have teeth.
He said his mom had teeth problems, and he was like, so she just had them all pulled. And I remember being so mortified. I know. I can't. It's like that's my worst nightmare.
Look, if it gets to a point where that's your only option, then of course you want to have teeth in your mouth. But there are actors that get all veneers, and that is literally
they shave your teeth down to
putting them, nubs. Making them nubs. Did you say nubs too?
I did.
Yeah,
they are. They shave.
They're
them
little
down
nubs,
to nubs,
and then all their teeth look fake.
You have big giant teeth.
Horse teeth.
I know.
Yeah,
I know.
I'm gonna keep these pearly whites.
I know. Oh,
and do my best to. I'm going to start flossing every day, Amy.
I have a lot of stories. I have a lot of trauma stories that just leap to mind. I remember watching Anna Nicole Smith when she got her teeth redone and like how traumatized she was. And like, I don't
remember that.
Remember her show?
The Anna Nicole show?
Yeah.
No, Anna Nicole Smith?
Yeah.
TV show?
Yeah.
I don't remember that out.
It was like one of the early reality shows. It was a train wreck.
Oh, wait. Yeah, it was a reality show. It wasn't a talk show.
No, reality.
Oh, yeah. No. Oh, I was watching that.
I remember her getting her teeth redone, and I was like, she was a hot.
But I don't remember
mess.
That. Bless her heart. She really was.
I know.
Did you see her daughter recently? Like,
no.
They were just on something like maybe in the last year. Maybe it was the anniversary or something. I don't know.
Oh, wow.
He still looks the same.
He does?
He's a little weird looking.
Wait, was it Howard?
No. Howard was the attorney.
The attorney. He's dead too, maybe.
I think so. I think he died of cancer.
No, the dad.
The dad, right. But now
he kind of looked like Kato Kalin or something.
Yeah, he had this weird hair.
Yeah.
Daniel?
Maybe. The son was Daniel too.
I don't know. Anyway, I know we're annoying all of you listening. You're yelling out these people's names and we don't know them.
You're enjoying it. You're walking down memory lane.
You're loving it. Well, come back for more, everyone.
Yes, please do. Email us if you want to. anythingbutmidpodcast@gmail.com. Follow us on the socials at anythingbutmid. Please subscribe to our YouTube. All that. We're working to build it up, and it's so exciting.
Yeah, and if you're just listening and want to watch this in action, head on over to our YouTube channel. Yeah. You can see this video.
And you can email us, share a mid-moment, or suggest a topic. Mm-hmm. We're open to ideas all the time. So thank you so much for being here. We love you so much, and do what you fucking want.
Do what you want.